So good afternoon, everyone. Welcome to our webinar today with Elder Abuse Prevention Ontario, co-hosted with the Canadian Network for the Prevention of Elder Abuse. We're pleased to present our webinar on mapping the contours of aging in the Canadian public discourse and countering its impact on older adults. I'd like to start with our land acknowledgement. We acknowledge that we gather on the traditional territory of a number of First Nations and acknowledge their stewardship of this land throughout the ages. We seek a new relationship with the original peoples of this land, one that is based in honor and deep respect. Thank you. Just a few housekeeping items before we begin. As I mentioned, we do have the option for closed captioning, which I'll turn on now, if I can find it. And we will, you can adjust your speaker screen, as I mentioned, by either pulling across the bar or changing your view to standard view or gallery view, depending on your choice of how you'd like to see that image on your screen. As I mentioned, we have our chat box and question box. If you have a question specifically for our speaker or that you'd like to ask, please post that in the Q&A box on your screen. And if you'd like to make a comment or a suggestion or have something to share, please put that in the chat box. Benedict will be monitoring both of those chat and question box during the session today. And please note that because we have large attendance, we are muting some of the all the participants for our sessions just based on time that we have, and to ensure that everyone's question gets answered at the end. So if you have something that you might want to ask, you can post it now. If you have something that comes up or you have in mind before, we encourage you to post that as well. Just to let you know, we do have this session being recorded. It will be posted on our website probably Monday, as this is Friday, so we will have time to get that uploaded to our website along with any of the supporting materials as well. It'll be posted on both of our websites for people to access. And lastly, just in terms of evaluation, we will be sending out a reminder to answer 7 quick questions just about what you've gained, your knowledge, and any topics you'd like to see in the future for future webinars. We do respect people's privacy and confidentiality at our sessions. These are public forums, so we do appreciate people keeping questions more in a general sense. If you have a personal issue or a situation you would like to talk to us about, please reach out by email or phone to our organizations, and we'd be more than happy to assist you in the way that we can help in your situation or answer any questions that you might have. For those who haven't joined us before, just a little bit about our organization with Elder Abuse Prevention Ontario. Our vision is to make sure that seniors are free from abuse, have a voice, and are safe and respected. So we do a lot of advocacy and education out in our communities and work with like-minded organizations to ensure that we reach older adults and provide programming and support and education to them. Back in 2003, our organization was given the opportunity and mandate to implement Ontario's strategy to combat elder abuse. This strategy is funded through the Ministry for Seniors and Accessibility, and we are accountable to the government in implementing that strategy, and which is quite fulsome. And we have 3 main priorities that fall under that strategy. But as you can imagine, there's many activities and projects that fall under each of these pillars. So the first is public education and awareness. We do a lot of public campaigns, education to senior groups. Many people are probably familiar with World Elder Abuse Awareness Day, which both Benedict and I have been working in partnership with other networks across Canada to help plan our themes and upcoming events. If in fact we've sent out a survey, if you haven't had a chance or seen that, to have your input on what topics you'd like to see at the sessions this year on June 15th. We do training for frontline staff of all sectors, And we work with our community partners, not only locally, provincially, nationally, and internationally, to look at solutions to assist older adults in the community. So I'm going to turn it over to my colleague Benedict to talk about the Canadian network.
Good morning, good afternoon, everyone. I hope you can hear me okay. So I am the executive director of the organization called CNPEA, which is the Canadian Network for the Prevention of Elder Abuse. We're the only pan-Canadian network working to address elder abuse prevention and intervention at this current stage. And our mission is really to kind of connect the work and the people who are trying to counter elder abuse across jurisdictions. So we connect people and organizations. A lot of our work is focused on fostering the exchange of reliable information. We do this through our website, www.cnpea.ca, which is a sort of hub that gathers resources that are trustworthy around elder abuse, ageism, healthy aging. We just pulled it all in one place to make things easy to find. That also includes, and I always want to mention this, a find help section where you can find information about existing supports in your area, province by province, territory by territory. And we, of course, also work in to advance program and policy that are related to preventing the abuse of older adults. So just similarly to EAPO and a lot of people who do this work, we envision a Canadian society where older adults are not only safe, but valued and respected and can live free from abuse. So we are always very happy to be part of these online events. So we're glad to see you today and welcome you. And I hope that you get a lot out of this presentation with Professor Martine Lagacé. Speaking of which, I would like to introduce Martine now. If Ryan, you can move that slide for me. Thank you. So Martine was appointed Associate Vice President of Research, Promotion and Development at the University of Ottawa in 2018 for 5 years. She's also a professor in the Department of Communication and is affiliated with the School of Psychology. She was the Vice Dean, Governance of the Faculty of Arts, and the Director of the Department of Communication from 2011 to 12. She has an extensive expertise in journalism as well, and has contributed greatly to the advancement of knowledge on the psychosocial aspects of aging, particularly as they relate to discrimination based on age, which is why she's here to talk to us today about ageism. So Martine has led several field surveys in Canada and abroad with workers and older patients to understand the impact of age-based discrimination. And she's particularly broken new ground in the Francophone community about the ageism that is experienced in that community. She contributes to several organizations, including the National Seniors Council, the Institut du Savoir Montfort, the Bruyère Research Institute, and the Institut Universitaire de Gériatrie de Montréal. Oh, the swapping back and forth between French and English. It's always hard. And I think today, particularly, she will be talking about two recent reports on ageism that she has been leading and in development and published, that were published at the end of last year, if I'm not mistaken. So I think I will stop here. There's, I'm sure, a lot more we could say about your career, Martine. It's quite impressive, but I would rather let you speak about your work. Go ahead.
Thank you. Thank you very, very much, Benedict. And thank you to Rianne as well for the invitation today from all the team, Elder Abuse Prevention Ontario and the Canadian Network for the Prevention of Elder Abuse. Thank you to all the attendees also who are with us today. I'm delighted to have a voice today to share with you some of the findings of two major studies that my colleagues and I have conducted over the last 2 years. One is has been done during the pandemic, the peak of the pandemic in 2020, in where we were trying to understand how and to what extent was ageism conveyed through public discourse, how government was talking about older adults, how government was talking about aging during the pandemic, how the media was discussing aging as well, how we academics discussed aging, as well as how older adults themselves were discussing aging, and that the goal was to try to understand if there was, these discourses were imbued to a certain extent with ageism. I must say, as a researcher, and I want to maybe put things in context, I've been doing research on ageism for the last, I would say, more than 25 years. I started my doctoral degree in 1997 and defended my thesis in 2004. And I remember at the time, more than, 3 decades ago, ageism was not on the radar of most governments and most public policy or decision makers. And as of today, we can at least acknowledge that there's been a lot of progress in the sense of we know now, it's quite well documented that ageism is unfortunately quite prevalent within the North American context, the cultural context of North America, and that something must be done about it. And one of the signs of such progress is the 2021 first global report on ageism that was produced by the WHO, which for me as a researcher was really an encouraging sign, telling the world that this kind of discrimination is, as I mentioned before, quite prevalent and needs to be combated. I myself, in my doctoral thesis, I was focusing on understanding the expressions of ageism and the manifestations of ageism, and most importantly, its impact. Very negative for individuals that are being the target of ageism, as well as for society in general. And I will give you a couple of examples of this in the next few minutes. Now, I'm coming from a background in psychology and communication, and I always try to combine these two fields of studies as our perceptions, how we see aging as a society, really has an impact on how we communicate about aging and with between us, young adults with older adults and so on. And that'll be the focus of the two studies that I would like to present you today. So I'll share screen. I cannot see anybody, but I just want to make sure that the presentation can be seen properly. Thank you very much.
Yes.
So I've entitled the presentation Mapping the Contours of Ageism in the Canadian Public Discourse and Countering its Impact on Older Adults. And I've been fascinating over the last 5-6 years about discourse, public discourse around aging as what we are exposed to as individuals on a daily basis by the media, what the media tells us around aging, what governments tells us about aging, does have an impact on how we view aging and how we ourselves experience aging. So there is a kind of an impact in terms of internalizing up to a certain extent these discourse, and the two studies kind of talk to one another in this manner. So that's the presentation outline. I do hope I can cover everything. There's lots of things that I would like to discuss and share with you today, and I want to have time for questions, certainly. That's the most important part for me as a researcher, is to get the attendees' perspective, questions and comments. I'd like to spend a little bit of time on how ageism has evolved in terms of definitions of ageism over the last 25 years. I mean, Howard Butler was the first researcher to define what ageism is, and that we were in 1969. Since then, there's been lots of new definitions showing how complex this phenomenon is. And then I'd like to spend a few minutes on our study that was trying to better understand discourses on aging during the COVID-19 pandemic. And that study really shows that ageism is often not expressed in overt or explicit manner, but it is very, very subtle. And the language that is used often conveys ageist stereotypes and attitudes. And then I'll touch on the social and economic impact of ageism at the end of the presentation. And if time allows, a few things on studies that we've conducted in terms of trying to counter ageism. We are at a turning point now. Something must be done to counter ageism throughout the world, and researchers are trying to reflect, and they're testing different hypotheses. One of them that's very strong and very, it's opening new ways of thinking around the topic of countering ageism is the intergenerational path. When we create spaces in a society for young adults to interact with older adults, it does change the mind frame around ageist attitudes and ageist stereotypes. So conceptualizing aging. As I mentioned, Howard Butler was the first researcher. He was an American psychiatrist, as most of you probably know. He was the first researcher to use ageism and defined it simply as discrimination targeting mostly older adults. Of course, we could have a whole presentation focusing on ageism targeting younger adults. Today, I'm focusing solely on ageism that's targeting older adults. In my view, it is I would say even a more serious problem because it connects to the way we think the process of aging within the cultural context of North America, which is still a process defined more negative than in positive ways. Now, in terms of how the definitions of ageism have evolved over the last years, I've included one from a colleague, Ayalon. So it is a complex, often negative construction of old age that takes place at the individual and societal levels. And I would add that it takes place in a conscious but also unconscious way, and the study on public discourse has revealed that. Now, the four circles that I've included here on the slide show different conceptualizations of ageism, different definitions of ageism, and I'm fascinated by the compassionate ageism, where there's way less research on that form of ageism, but it's one that's quite spreading right now in how we interact with older adults in context of the caregiving in the workplace as well. So hostile ageism, as the word kind of says, is about really thinking old age and thinking aging as a process in mostly negative terms. And it's often expressed with explicitly negative stereotypes. And I'll give you an example that you probably heard many, many times, but for me, it was a reality check during the pandemic. You may remember that during the first 3 or 4 weeks of the pandemic on social media, there was this hashtag circulating naming the COVID-19 virus the boomer remover, which is obviously an extreme hostile and negative language and an example of hostile ageism. And when we hear, for example, that old age is a burden to economy or to the healthcare system, that's another explicit ways of conveying negative stereotypes. Now, in the case of compassionate ageism, which is, I would say, it appeared, the expression appeared about 10 years ago. Compassionate ageism actually says that ageism is complex because sometimes it combines positive and negative stereotypes. So compassionate ageism, while it's hiding behind good intentions, it conveys the view that as we age, we are very nice people. We are very sociable people. So high on the warmth dimension of social cognition, but low in terms of everything that relates to competency, and competency in a very generic way of understanding the word competency. So not having self-agency, not being able to attain your life goals, not being able to speak your mind, not being able to make your own decision in terms of your life path. So compassionate ageism hides a view that as we age, all of us become fragile, not capable, not have of deciding, not having no self-agency. And compassionate ageism is quite well documented in the context of caregiving. Unfortunately, when we think of an older patient as not being able to make their own decisions. And it can be conveyed, for example, an example of compassionate ageism is when we speak on behalf of older adults. We decide on behalf of older adults what's good or what's not good for them. Unfortunately, during the pandemic, there were lots of examples of compassionate ageism. The intentions may be very good, but the end result is very negative for the person that's being targeted by compassionate ageism. And the colleagues from Great Britain, I'm thinking Howard Giles, and also I can send the reference, have named the compassionate ageism. They call this the fourth age ageism. And their hypothesis is that more and more the oldest of the old seem to be the target of compassionate ageism, as there seems to be some kind of a view that older adults living in long-term care facilities are all of them, and there's a part of truth, but the problem is the generalization. All of them are not capable of deciding, they have no self-agency and so on. So compassionate ageism will be the focus of one of the studies that I'll be presenting in a few seconds. And then there are two levels, we could explain it this way, two levels of ageism in the way it's conveyed. So it can be conveyed from the younger adults towards the older adults. So this is that refers to intergenerational ageism. While intragenerational ageism refers to older adults subscribing to negative age-based attitudes towards older adults themselves. And sometimes we've seen this, my colleagues and I, in a couple of studies that we've conducted, but it's also well documented in European studies and other Canadian and American studies, whereby adults that are autonomous, that are independent, that are living in their own home may subscribe to ageist views about adults that are living in long-term care facilities, that are not autonomous, and so on. One explanation of intragenerational ageism is the anxiety around losing your autonomy, about not being independent anymore and having to ask for help. I'll come back on this notion in a few seconds. Okay, so the study that I would like to present, I'm just sorry, somebody's sending me an email. Sorry, an urgent email. So the study that I'd like to present relates to public discourse and how the discourse, as I mentioned before, may convey ageist stereotypes, and to what extent, if it does so, to what extent does it do so, and what is the impact of this on individuals who are being targeted by such discourse. And somebody may say, you may ask yourself, why discourse per se? Because discourse, language is never neutral. The words that we choose to talk about aging, to talk about older adults, the words that we choose reflect the perceptions that we hold on to. It reflects our own beliefs. So language is not neutral. It is a social construction of reality. And if we take this statement from Michel Foucault, the sociologist, from his perspective, Foucault would say that the discourse constructs some kind of a way of thinking, hegemony of certain norms and ideologies. So we ask ourselves, when doing this study, What are the norms? What are the ideologies stemming from the public discourse around aging and older adults? How is it framed by the media? How is it framed by the politicians? How is it framed by the researchers, by academic, and by the older adults themselves? So, and I must state that the study that we've conducted was requested by Employment and Social Development Canada, and it was a pleasure for us to conduct, and also it sent a signal that the Canadian government was also serious in the effort on reflecting how they communicate themselves around aging and older adults. And again, another reason to focus on public discourse when trying to understand ageism is that what we hear around us, the norms of, healthy aging, productive aging, successful aging, all these models, norms, and ideologies stemming from public discourse can also be internalized within a person's self-concept, and as such impact, to a certain extent, our self-esteem. And I'll come back to this in the last part of the presentation today. So the goals of the study, we asked ourselves two questions. How were older adults and the aging process portrayed in the public discourse during the COVID-19 pandemic? And the sub-questions to that main question was, were these discourse imbued with ageism? And if so, how were they imbued with ageism, and to what extent as well? So we targeted 4 types of public discourse. We targeted op-eds from journalists, and that includes the Globe and Mail. We included La Presse. We've included, I'm sorry, I can't remember, but I think they're listed on the second, but French, the most popular newspapers in French and in English in Canada. We've also targeted op-eds from older adults who decided to write something in the Globe and Mail, in La Presse during the pandemic, or associations defending the rights of older adults. So the idea was to analyze, what were they saying? What was the framing? What was the angle? Was there ageism between the lines of these articles? We've also included scholarly articles. So we as researchers, how do we talk about ageism? What's our focus? Are we ageist without, unconsciously being ageist? And the last discourse that was studied was the federal, provincial, and territorial communications and the press briefings. So throughout Canada. So in terms of selection of documents, because we could have analyzed thousands and thousands of documents, but we were constrained by time, we focused on documents that were published in April, first, so almost at the beginning of the pandemic, mid-September, and then mid-October, and then December 2020. So three period of the year 2020, where we were really in the middle of the pandemic. So our final sample was comprised of 110 documents divided, as can be seen. We analyzed 20 media op-eds, 20 articles written by older adults themselves, 10 paper written by academic researchers, and 60 documents, either press briefings or communication documents stemming from, as I mentioned before, federal, territorial, and provincial governments. And we created a coding grid. I just wanted to share with you our methodology. So we developed a coding grid whereby we're trying to analyze each document by domains and themes, and asking questions such as, is ageism exacerbated in these articles, or is it criticized? What's the framing of the aging process? What roles are attributed to the older adults during the pandemic? Do they have agency? Can they participate in the collective, the resilience effort, or are they framed mostly in vulnerability terms? So this is a snapshot of our findings. In terms of the main theme and the domain, the most frequent theme, and this is about it was counted, the most frequent word stemming from the 110 documents comprised, so covering the, op-eds from journalists, older adults, media, government, and academics, was the word vulnerability, the vulnerability of older adults, and especially in long-term care, and the societal need to protect them. And we could say, okay, that's not ageism, but the important thing to keep in mind is that it's the focus placed solely on vulnerability in the large majority of these documents that, again, is framing, it's giving us an idea of how we see aging in older adults in the context of a crisis. And I've included an excerpt here of a press briefing, whereby the expression of most vulnerable is used, and that's just one example. But in the 110 documents, the framing of vulnerability was it appeared in the highest frequency. Now, what was the framing of the aging process per se? And once again, in the majority of documents, and mostly press briefings from governments, associated the process of aging as a loss and a burden, for a social and economic burden. And I've included once again an excerpt of a press briefing. We are dealing with an aging population with ever increasing needs and demands, and we are only at the beginning. Of course, there's a part of truth in that, but once again, it's a matter of frequency and the extent to which we are always exposed to such framing. And that's if we hear this constantly, that an aging population is a problem, is a burden to society, to the economy, to the healthcare system, and so on, it simply feeds on anxiety towards aging and feeds on ageist attitudes and stereotypes as well. Now, were these documents actually exacerbating ageism? The media op-eds, older adults op-eds and press briefings have exacerbated ageism through their discourse, indeed, up to a certain extent. And here's an excerpt of a media article, and I've underlined I've put in bold the last sentence, and I'll let you read that. So that last sentence, many of them, we're talking about seniors confined to their beds or need walkers or wheelchairs to get around. Many of them, given the opportunity, would say without hesitation that they do not want to be a burden to others. I just want to link this back to compassionate ageism. We are speaking on behalf of these seniors. We are deciding, we are saying that if given a chance actually to have their voice heard, they would say that they would not want to be a burden to others. That's an example of compassionate ageism. Were these among these 110 documents that we analyzed, was there kind of good news? Was ageism criticized? It was mainly criticized by scholars and to a certain extent, a lesser extent, by older adults themselves. So the ageist discourse was criticized as well as its negative impact. For example, here's an excerpt of a scholarly article. The current situation has highlighted the need to rethink the status and role of older persons in our society and to specifically address the impact and influence of ageism in decision-making and caregiving. Interestingly, I must say that I myself as a researcher, I had never seen the use of ageism so much than during the pandemic, which is kind of good news because it really pushed the urgency to start discussing and rethinking how we view aging. And ageism was the word itself was quite present in many of the document. Now, the last sentence of that slide is a question that my colleagues and I ask ourselves. Yes, ageism was quite criticized, but it was the ageism that's mostly targeting adults that are autonomous, that are independent, that are living into their own home. Ageism targeting older adults living in long-term care facility was way less criticized, which when we come back to the conceptualization of ageism, could could point to the idea of intragenerational ageism. Older adults stood up during the pandemic and they said, no, that, you know, what the policies that are put in place, the measures that are put in place, the discourse that we're hearing, no, we don't want to hear that. And we disagree with this. It's an ageist discourse, there are ageist measures and so on. But it was mainly criticizing these measures and these discourse towards those who are autonomous, those who are independent, but not defending those who are a little bit more fragile and vulnerable and living in long-term care facilities. So once again, that for us, it prompted us the question of, was this like intragenerational ageism or a form of compassionate ageism, but expressed at the intragenerational level, what we call the fourth age ageism, targeting the oldest of the old and those who are indeed more fragile. What were the roles attributed to older adults during the pandemic? So the majority of speeches portrayed older adults, and that's very interesting, as victims of the pandemic, rather than citizens capable of contributing to the fight against pandemic. So what that, and I've also included an excerpt of a press briefing, but why is this like a problem? Why is this ageism per se? Because it kind of conveys the message once again that aging as a process is about deficits, it's about loss, it's about not having self-agency, it's about not being capable of participating in the collective effort to fight against the virus. They were mostly portrayed as victims that other age groups must sacrifice in order to protect the victims. So we're still in that framing of vulnerability. So if we summarize the findings, the vulnerability of older adults is by far the main theme discussed in the 4 types of discourse. Once again, there's part of truth in that, but the fact that it's the main focus of the discourse, certainly we can ask the question if that is compassionate ageism. Older adults in our study were portrayed mostly, as I mentioned before, as victims of the pandemic with no self-agency. Scholars, yes, at least some, criticized ageist attitudes and behaviors, as well as the impact on older adults' mental health and self-esteem, and so did older adults. But as I said before, however, their critiques mostly concern healthy and autonomous older adults, which could be a sign of compassionate ageism or intra-generational ageism. And our study also showed that older adults' strengths and contributions to society were rarely acknowledged in these documents. So that's the finding of the study that we've conducted in 2020. And if we connect, how we talk about ageism in the public sphere to the impact of ageism, we know that, and there's been lots of study in social psychology that show that what we are exposed to at a societal level in the public sphere does have an impact on how we experience aging and how we see aging. So Employment and Social Development Canada had also asked us to look at the economic and social impacts of ageism, but that was before the pandemic, I must say. They had asked us to do some kind of a scan of publications, academic and non-academic documents, so produced by governments, organizations that present or represent older adults. So documents that were published between 2014 and 2019 in French and in English, to try to get a sense of what can we get in terms of what's the impact of ageism on older adults and on society in general. So it was a critical review of literature, and we focused on different domains: employment, health and healthcare, social inclusion, safety and security, media and social media. We've analyzed 136 articles relating to the impacts, the social and economic impacts. Now, that's not very surprising. We still cannot put a number, a dollar sign on the cost of ageism. We know that it has very, very damaging impact psychologically and socially, definitely. But there are very few studies, and that I think economists should get on board to calculate or estimate the costs of ageism for society. But France and United States are among the few countries that have estimated or tried to estimate the economic cost of age-based discrimination. For example, and I've included that study, US researchers try to calculate the cost of ageism on health conditions for people aged 60 years or older in the United States over the course of 1 year. And the conclusion was really crystal clear. So the more you're exposed to age-based stereotypes and negative self-perceptions of aging, these aggravate the medical condition, resulting in a 1 year cost of $63 billion. We have not done such a study in Canada, and I think that there is a huge need to conduct such studies, because unfortunately dollars speak, and they could certainly influence public policies around aging in older adults. In terms of social impacts, it's very, very well documented that ageism has a very negative impact on the physical and mental health of older adults. And these include impacts in the context of caregiving, in the context of the workplace per se. So much of the literature demonstrates that, and that's a fascinating phenomenon, that when you're exposed to stereotypes nonstop, you tend to internalize these stereotypes, these ageist stereotypes, and that leads to behave in a way that reinforces these stereotypes, which is a phenomenon that is called in social psychology the self-fulfilling prophecy. If you tell an older adult, well, I'm going to test you on your memory, I'll ask you to retain 10 words, and I'll ask you these words in 2 minutes, just by stating, I'm going to test your memory, and we know that memory tends to decrease with age, which is a stereotype. The negative effect will be seen in terms of retention of these words. So there is that tendency to internalize what we hear around us around aging and older adults. I'm going to stop here, and I would like to thank all my colleagues who've participated in the 2 studies. Dr. Meret, who's an economist, Dr. Naveau is also an economist, Dr. Sullivan from University of Ottawa, Dr. Caroline Bergeron, and our PhD candidates, without whom we could not do any studies, Pascal Dangois, Amélie Doucet, Amanda Max, Samantha Uslander, and Philippe Rodrigue Rouleau. And also, I'd like to thank Employment and Social Development Canada, who have asked to conduct these 2 fascinating studies. And the link to the studies are included in my PowerPoint. Do I still have time, Benedict?
Yes, you still have a few minutes if you want.
Just a few minutes, because that was kind of the third part, and it's an important part. Now that we've stated that ageism is conveyed in the discourse, that ageism has a very negative impact on society, and it is costly for society and for older adults themselves, and for younger adults, definitely. There's a lot of thinking and research that has been done over the last, I would say, 6-7 years around what are the best initiatives, what are the most efficient initiatives that could be put in place in terms of combating ageism. And the literature shows that the initiatives that combine education, having a training, educate younger adults, integrate, for example, courses in gerontology and on aging in the curriculum of high school students, combining education with also higher levels of intergenerational interaction are shown to be the most promising in changing attitudes around age, of course, in a positive way. So having generations connect with one another, creating space, to spaces in place to facilitate contact between different generations, in combination with education, has proven to be very effective ways of countering ageism. And I just want to show you looks like a boring model, but we've tested that hypothesis of intergenerational contact in the workplace, in the context of work, to try to see if it does have an impact on changing people's view of aging in the workplace, at least, because ageism in the workplace, it's another conference. There's a lot of ageism in the workplace that's under tackle and ignored. That model that we've tested it with 603 Canadian workers, and I just highlighted in yellow. This is the operationalization of intergenerational contact. So we've asked workers from 18 to 68 years old, well, how would you assess the quantity and the quality of intergroup contacts with younger adults and older adults? And to what extent does your organization encourage, support knowledge sharing? No, so has put in place knowledge sharing practices. And we've tested this to the extent to which it has a positive impact in terms of thinking who are older workers. And I'm just going to focus on the left part of the model. There were statistically significant link in terms of the more an organization facilitates quantity and quality of intergroup contacts and knowledge sharing practices, the better are the views, the attitudes around older workers in the context of work, and even more so on the right part of the model. It increases work engagement for workers of all ages, so younger and so it says that these quality and quantity intergroup contacts are very beneficial in terms of countering ageism, but also increasing work engagement for workers of all ages. And that's a study that we've conducted in 2022, so it's quite recent. I'm going to stop here and thank you for your participation. I really look forward for questions, comments, suggestions.
Thank you, Martine. That was really, really, really interesting. I have a couple of questions already for you from the Q&A box.
Can I stop sharing, Benedict? Yeah.
Absolutely. Yes.
Okay, I will do so. It's easier. Yeah.
And so we have Mary Whale is saying it's really great to have current Canadian affirmation on the impacts of ageism, and particularly when it comes to the insidious presence of ageism in healthcare, it's very alarming. And so the question is, what can we do beyond, building up our own awareness? Are there practices, actions that people can take?
Well, for me, I'm a big believer in education. I think it starts there. If ideally, if politicians would be open to, or decision makers in terms of education, to integrate courses around, it doesn't have to be entitled ageism per se, but it starts at a very young age, how we view aging. So I would integrate courses in the curriculum of, at least high school, and if not, at least university, like courses in psychology, social work, medicine, nursing, and so on. I would start with that. And definitely, I think I'm also a big believer in older adults voicing that. They stood up during the pandemic. And for me, that it was great to read these papers, these articles that, older adults have enough of ageist attitudes. So also the engagement of older adults themselves will change a lot. Yeah.
Thank you. I think that actually answers Pamela's question, and went to the second one in the Q&A box, which was asking or saying, nothing about us without us. How does this work and this research involve seniors? So I think you kind of started touching on this a little bit already. And
yeah,
we have,
if I can just, sorry, we had published an article actually entitled "Nothing About Us Without Us," and it was in the context of care transitions, older adults moving from a hospital that had to move to a long-term care. And this is a critical time in a person's life, especially when it's not your own decision. But our studies had showed that they were not involved in the communication process at all. Decisions were taken on their behalf, and we're talking about your home. You have to have a say in where you're going to live. Yeah.
Agreed. And we have the $1 million question following, which is, how do we get this message out to the people who really have to hear it, i.e. policymakers?
I can respond from my own. I'm extremely engaged with government policymakers, and every time that I have the opportunity to share the findings of our studies, for me, it's, but I think that organizations like yours, it's what you're doing today, these presentations, and if they can be spread on social media, and I must say, I was very encouraged by number one, WHO produced this first report on ageism. As I said when I began my presentation in 2004, 1997, when I did my PhD, some people were laughing at me. What are you talking about? What's ageism? They didn't even know what ageism was. I mean, 30 years after or more, we are taking this thing seriously on a global scale. So I'm becoming more optimistic now that it's taken seriously. Yeah.
Yes, sorry, I'm seeing a lot of really interesting comments popping up in the chat too, and I'm like trying to decide which one to go for. So we have a person commenting anonymously that they work in government, and in their experience, it's a fairly ageist environment for the staff. And it obviously extends to policies toward the population as a reflection of the internal dynamics. And so they're afraid that it requires an external push, which is where people like us come in, to force governments to do ageism training, to kind of kickstart that process from the inside. And I have to absolutely agree with that comment, and that's why we've last year CNPA produced this engagement strategy called Future Us, and one of the top kind of recommendations that's in there is that ageism training needs to be included in basically DEI training. And so have that be a part of professional development, regardless of where you work and what your role or your profession is. It's something that everybody benefits from and can also help, as you were showing in one of your last slides, kind of build those intergenerational connections within the workplace where you can actually have this sort of mentoring, like mutual mentoring in place, where some strength from one, people from a certain age can benefit the other group of younger workers and vice versa. We're very, very big fans of that idea.
If I can just add also, I think that, right now we are at a turning point in Canada in terms of thinking equity, diversity, and inclusion. And there's great work being done around equity, diversity, and inclusion. But I often think that we forget age when we think of equity, diversity, and inclusion. And I would hope that, the age factor would be included in when we think about EDI, when we think about equity, diversity, inclusion. It's often kind of the blind spot on the radar of discrimination. Yeah.
Agreed. We have another question, kind of following the first one, which is, do you have any suggestions on how to increase awareness about compassionate ageism? Because that is probably the most, maybe not the most common, but the hardest one to pin down, because it comes from a quote unquote good place. What are your suggestions, whether it's compassionate ageism in the media or in your interpersonal relationships? How do we tackle that?
That's a very, very good question, because we're not research wise, we're not done, trying to understand completely. It's a very complex phenomena because it stems from good intentions. And it's also linked, in my view, to the fact that we live in a society that's so focused on you have to remain autonomous, you should not ask for help, so you have to remain independent and so on. So I think that just on an individual level, not accepting to be framed as vulnerable when people interact with us, as not being capable of learning new technologies and so on. And I think there's lots of awareness that still needs to happen in regards to compassionate ageism towards government and so on. It's a rather new territory that we are contemplating now. Yeah.
I will just add something because it happened to me just a few days ago. I was interviewed for something and the person sent me a copy of the article pre-publication, and it had all these components that you listed in your presentation. So the vulnerability, the fragile, everybody's fragile and needs to be protected. And it was meant in like the nicest way possible, but it nonetheless read terribly. And so I'm working on more often now saying, actually, could you change that language? And I know it's not always a pleasant thing to have to do, but I would say, regardless of what the situation is, doing a kind correction and pointing out, this is a blanket statement that frames everybody as frail, and that assumes that aging means becoming vulnerable every time, no matter what. It's kind of pointing this out every time. I'm hoping creates that change for somebody who especially is writing, that might be something that sticks with them. And so the next time they tackle the topic, they might approach it differently. So.
I must say that I had shared part of the findings of the study on public discourse, and there were doctors in the audience, and they reacted extremely positively. They came to me and said, okay, I think I'm going to stop talking about older adults vulnerable. They had this openness to at least self-reflect. And if I can just also mention the fact that it's Employment and Social Development Canada that has asked for that study on public discourse. So they wanted to reflect on how they themselves, speak about aging and older adults. For me, that's extremely positive. It's pointing to an effort in changing things around aging and ageism.
Yeah. And speaking of doctors, someone is asking, how does ageism affect the current backlog in our healthcare system?
That's a tough one. That I haven't done research on that per se, but there was lots of things during the pandemic. Who gets care, who does not get care. I'm sure that if it's certainly not a causal factor, but it's certainly correlated to how we provide care and who we decide will have the care, and so on and so on.
Mm-hmm.
Yeah.
Margaret Gillis is saying, thank you for this great presentation. I'm wondering about benevolent ageism. I think this is really a topic that is hitting a lot of people. You mentioned there was not much information on this issue. Is there other literature on benevolent isms, such as racism, for instance? If so, what is the impact of this on those who experience it?
The impact of
benevolent other isms.
Yeah, well, the impact of benevolent on other isms. Mm-hmm. That's a great question.
Like benevolent racism. Do we have more data on that? If we don't, we don't have yet a lot of information about the benevolent ageism, but maybe we have information on benevolent racism.
I have not encountered any literature on benevolent sexism, but as women, I think we've all have experienced benevolent sexism. I know what's best for you. That's everything related to compassionate and benevolent ageism hides the sentence, I'll do it for you. I know what's best for you. So, yeah.
It actually is funny you say this. We had a comment earlier in the chat box from Jacinta saying it would be interesting to study the intersection of compassionate ageism and benevolent patriarchy.
Well, you know what? This is the reason why I love attending, being present at conferences, because it gives me ideas of future research. Absolutely. Yeah.
We had a question about leading practices for intergenerational engagement, programs, policies, strategies. Are there anyone that you know of or that you would recommend?
In the report, actually, there is a whole section on the initiatives that were taking place throughout Canada, and it was not exhaustive because we had a time constraint. But I've given an example in the context of the workplace. It seems that intergenerational and knowledge sharing practices between generation is quite effective in terms of decreasing ageist attitudes. My colleagues at the Faculty of Health Science here have put in place a program where they send students in gerontology. They become volunteer work. They do visits in the hospital, and that's more of an anecdote. But I was told that it changes their ways of aging completely. And some of them have decided, I'm going to be a geriatrician, to the extent, just having a contact with an older person changes your mind frame. And it's true for racism and it's true for sexism. When you sit down and you get to know a person really on a one-to-one basis, all your prejudice or stereotypes change. And we've all experienced this. Yeah.
And Canada has been a leader now for many years, I think, in initiatives around intergeneration connections. There's just to go along that question about resources, there's a few organizations like I2I Society in BC, we have Linkages, we have
there's many.
I'm blanking. There's
many
across, and then there are new programs coming up that are such as the Home Share program that is expanding its reach across Canada to connect safely and accurately older people and students who can live together and kind of each benefit differently from cohabitating. So I think there's a lot happening. We do have a fair bit of information about this on our website for those who want to kind of go looking around. And I also wanted to mention Marta, the ED of EAPO, is with us in the chat box, and she pointed out that there is this new Canadian Coalition Against Ageism, which has just been created.
Indeed.
And so we're seeing this groundswell happening of more organizations working together to start putting ageism on the radar of decision makers and of the public in general. So I think sorry, I'm realizing as I'm speaking, we are at the end of the hour. There are a lot of great comments in the chat box, so you can still have a look. I think lots of just people being appreciative of your presentation and agreeing with you. I'm sorry, I'm seeing if there's anything else that I want.
I'm also going through. But I mean, I just want to thank every attendee today. It was a pleasure for me we could have discussed this until 5 o'clock today. I would be happy to do so.
Oh, I see we have Sherry Baker as well, who is saying from her perspective as an 83-year-old professional working full-time, she looks forward to the day when people will stop asking her, are you still working?
Oh, yeah.
You don't look that old, and all those terrible questions. And of course, Pamela making the really accurate comment that employing seniors in organizations and services that work to protect the rights of older adults is kind of key, and involving them in research, which is something that I think is also happening.
While you're reading the comments, it'll be also interesting in the context of labor shortages in Canada to see how ageism is tackled in the context of work. Employers know that they need to retain older workers now, for those who want, of course, to stay in the workplace. But will the attitudes change? That's a question mark. Yeah. Agreed.
Well, I think we have plenty more comments to read through, but I think you have inspired a lot of people today. A reminder for everyone, the links to the reports that Martine has put out were shared in the chat box, but we're going to send them again to all participants afterwards. And you can also find them on cnpa.ca if you go looking. The slides of the presentation will be made available on both cnpa.ca's website and EAPO's website. We'll make sure that all the information that's available gets to you, and we look forward to seeing you at our next webinar. Rayanne, up to you.
Thanks. Thank you, Martine and Benedict and all the participants for all their great questions. And we'll post those a couple questions in the chat box about some of the reports that were mentioned. So we'll find those and post them on our website as well. And the ones that were shared in addition to ones that Benedict. So we'll put all those information there. And Similar to other presentations, if we find that, we want to do further Q&A kind of sessions, just answering people's questions, which we've had great discussion, we could possibly, based on Martine's time, do maybe a part 2 session. And Martine has also said that she may be able to do this session in French as well, to have some outreach to our Francophone communities across Canada as well. So stay tuned for that date. It's coming up. I did put in the chat box. We are hosting a conference next week. Oops, it's not sure where that slide went. Anyway, it's on Tuesday and it's on risk assessment for older adults. And if anybody's interested, there's some limited seating left now because we are filling up quickly. So if anybody's interested in coming to that, go to our website or go to the link that was posted in the chat box as well. Thank you so much, everybody, for participating. We look forward to everyone coming to our future sessions, and have a great weekend. Thank you.
Thank you all. Thank you.